Welcome back, everyone. We're here live on location at the MSPExpo in Fort Lauderdale, brought to you by the Managed Service Provider Association of America.
Of course.
I'm here with a very special guest. You're not going to want to miss a second of this. Adam Courchiane from Ascent Concierge Health.
Yes.
Fantastic.
Thanks for having me.
All right, Adam. Business owners. You're a business owner.
Yep.
The MSP Association's group of small business owners, MSPs, we're talking to you. We're entrepreneurs that love to invest everything into our business. Our time, our money, too much of the money sometimes, our time, but also our health.
Yes.
Whether consciously or unconsciously, our health is being invested into this business, which is a quickly depletable resource that when you go too far can't be replenished. Tell us your story on how you combat that.
Okay, so for me, I've been in medicine for just about 20 years. I think I'm on my 20th year. And I've run around, I've worked in hospitals, I've worked in pediatrics, geriatrics, I'm an Army PA. And probably about 7 years ago, I said, I can't do this anymore. It's just, we're not taking good care of each other. So that's when I started doing things a little differently. So I stopped working with insurance and I started taking better care of people. So I guess that's the start. And then from there, more and more, I said, I could take good care of, Mike's broken problem, and we're really good at that. But as we dig deeper and deeper, I'd rather not have problems. Like, how about we go for health, be optimal, that kind of stuff. Mm-hmm. In the medical model, is it good or is it bad? And the answer is, well, it depends on what you have. If I have a heart attack, 911, it's a great place to be. Western medicine is amazing at acute care. But chronic care, it's abysmal. So if you know anyone in your life who has a chronic issue, it could be obesity, fatigue, blood pressure, cholesterol, diabetes, who got healthier? And the answer is they might have gotten a little things that got better controlled, but they didn't get rid of it. And most of these things we can. Probably 95% of these things we can reverse. So for me, that's the challenge. And the idea is, in the medical model, we can look at your 10-year cardiac risk score. Like, that's important. You're a young guy. What about your 40-year cardiac risk score? On average, the last 10 years of your life are going to be pretty rough. You're going to be fighting disease. So that's something you look forward to. Or, we can have lifespan, how long you're on Earth, and health span, how long you're healthy. And if we can have those be pretty darn close, now we have healthy, happy humans. Okay, so we're probably at least two personas here. Yep. The business owner that's burning out. They may not have hit rock bottom, but they're like an outsider can definitely see that they're on the downward swing. Yep. They're high with the stress hormones. Of course.
Or you have the second persona of business owner that's like the A-type that wants to get better. And we were having this conversation in the car on the way here because I'm trying to get the free advice while I have you. So talk to both of those. Let's start with the person that's burning out. Okay, you're the medical professional. You can tell they're burning out whether they can see it or not yet. What is the word to them? So
I'll answer a little sideways because I think maybe what we're asking is, how do we tell more obviously that you're not awesome? Because if you've hit rock bottom, you've hit it. And even in the medical world, we have, we use it burnout or moral injury, like I just can't do it anymore. But if I'm not ready to admit that, sometimes we check extensive lab work. And if it turns out, there's the obvious labs, how's your cholesterol and what's your blood pressure? And those are important. How are your inflammation markers? What's your vitamin D level? How are your sex hormones? All of these things are so important. And for, a lot of the tech industry, we like objective data. How do you measure it? So I call labs, the extensive labs that we do, I call it a report card. So if we come back, and a lot of people will interpret that and say, yeah, your labs are in the range, you're okay. Like, where did that range come from? And I can't remember if I said this to you this morning. The range came from who had a heartbeat. So if you have cancer, part of the range. If you're the most sick person you've ever met, part of the range. You're talking about like the statistical spread includes too many people, not just the persona. Right. Best segmented for your patient. So when you look on your labs, it doesn't say healthy range, it says reference range, so human. Okay, this isn't a histogram, this is just the x-axis. Yes. Okay. So what you ask your people is, am I in the optimal range? And they'll probably be like, sure, yeah, you're in the range. But we like to dig really deep. I don't want to be just average. Average? Like I said, 10 years of suffering. Right. That's pretty average. So I tell people, for me, the day I die, the day before, I want to go for a hike and say, okay, now it's my time, as opposed to I'm back in a bed for 10 years. But to answer your question about the tech people, we've had so many people that we've met at these events who say, yeah, I don't know if I could do it anymore. Like I said, that's the obvious one.
Right.
That you're suffering. But for the other people, and I don't mean to call anyone out, but how many people do we meet at these events that are, the one thing you can see is weight.
Yeah.
So a lot of people are really overweight. How many people are on their second, third, fourth marriage? That doesn't scream emotional stability. And there's many, many reasons. I'm not judging anything, but just how are things? How are your relationship with your kids? You know, those things are really important, and that should be part of a healthy human.
Right.
We are relationship builders.
Yeah, and it is just a part of the image that you present to others, and not just about weight, but more about adding to your confidence.
Yes.
Right? Your mental foundation.
Yes, good, yes. Keep me on track, because I can babble for years about this stuff. And I always tell people, I know this from personal experiences. You see some people on social media, and they look amazing. And they're with this person, it looks amazing. But then they see me in an exam room and they tell me that they want to kill themselves.
Yeah,
or they're depressed.
Sure.
So like
Our outward appearance is merely the tip of the iceberg of our
who's prettier,
persona.
not this guy. But behind the scenes is all the other stuff. So for me, it's became a passion is how do we optimize this animal? We're Homo sapien. We are animals. So part of it is live more like an animal. So, we need to eat nutrition that's proper, physical activity, sleep, stress relief, sense of purpose. Like why are you really doing this?
Okay, let's talk to the tech brains.
Okay, yes.
Okay, there's tons of MSPs on this channel. They got the tech brains, great. How do you phrase it like that to them? You talked a little bit about the emotional and social aspect of health.
Yes.
Give us some practical advice here.
Okay, yep, I can do that. So the labs, that report card, that's something I can print out. I write all over it. We go through those things. Wearables, like I'm wearing an Oura ring. I've got a Garmin watch.
What do those do? What's that giving you?
So,
because we love throwing money at problems. How do you differentiate just like paying to make this go away with your eyes closed to something that's meaningful?
So you could look at, just as an example, like your average heart rate. So if I can lower my heart rate by 5 points over the course of a month or 2 or 3, that's less stress on the motor. So we can do that sort of stuff. Or you and I were chatting about sleep, and if you go out for that work meeting and have 8 drinks, you can track your sleep, and maybe it's worse. And again, I always tell patients, don't listen to me, listen to your body. So if you can have data.
That's a cliche that people hear, and I'm sure that the process-oriented tech minds are going to scoff at that. Like, listen to your body. What does that mean? Like, if we're talking about the wearables, that's fun because it gives you a little consumerism itch too. What should we be looking at? Like, let's talk about the sleep because that's what we're talking about this morning.
So, and I'm one of those people. Like, my body doesn't speak to me very well, so I want to measure things. So I have people use 8 Sleep or a chili pad on your bed, change temperature, and it measures things that you can measure: a heart rate, how much you're asleep, sleep efficiency, your REM sleep, your deep sleep. You can measure all these things. Heart rate variability is another really big one. Blood pressure. And they have smart cuffs, like Garmin's got one, Withings has one, and it's nice because you just look at your phone, and you're like, oh, here's my blood pressure, here are my averages.
And that's gives you something meaningful. Like let's say for the business owner out there that's listening, that's not going to come to Colorado to be in-person patient with you.
Yep.
We're not getting an affiliate kickback from Garmin or any of these sleep trackers, but is that a meaningful thing that they should consider?
It is. I was just going to think of another different one, but my oxygen saturation. I was just talking to a person who happens to be sharing a booth with us over there, but he was saying he dropped 30 pounds, and he said his blood pressure was in the 170s for the top number, the systolic, and now it's down at 120, which is, that's outstanding. He got off of medicines. That's I didn't do it.
Right.
He did it with someone else. But that's an outstanding story. That is it. So.
And how did you achieve that?
He got his hormones optimized. He started eating different food and started moving.
Okay. Again, so all basic things, but it takes both an emotional and time commitment. Because, like if you're falling into the trough of, I don't have time.
Yep.
You got to make time.
It's tough because I can tell you there are times when me running 2 to 3 businesses and all that stuff and having a family and trying to be married and have 4 dogs, there are days and honestly, like the sense of purpose part and the stress part, there are some days when I've said, not today. Today is the day for grace. Like, just nope. Get home, have some food, maybe watch a show. That's it. But on the other days, like, I'm a guy, right? I used to say, 90 minutes for a workout. I've only got an hour. I'm going to do nothing. And it's silly. So, like, I've struggled with this, but there are days when I'm like, I've got 23 minutes. I can do some push-ups and pull-ups in the basement for 23 minutes.
Yeah.
It's way more than 0.
Right.
And then the whole day you're just like, yeah, I feel a bit better.
Okay.
So yeah, I don't know if that answers
So
that
I mean,
question.
those are basic tips. Like,
Yep.
I don't think you're the first person to tell someone listening to get active. That's a basic tip. What do you see as the trigger that gets people to finally come to you? Because a lot of what we're saying is common knowledge. Like,
Yes.
they're hearing it from everyone. Everyone's
Yep.
telling you, get active, get fit, move around, whatever, drink water. What triggers someone to finally come to you? Because that might help person listening relate to that.
Okay, so, and I'll tell you, sometimes it really is that simple. But the thing is to say, what can you not do? So if you decide you don't want to go running this afternoon, you decided, don't do it. But if you say you can't, well, now you put a limit. And you can't go up the stairs anymore. And you can't get a good night's sleep without those medicines. And you can't. We're starting to separate that health span and that lifespan. So when you slow down long enough to say, I can no longer, can you go running around the woods with your friends? Sounds like children, but we do that with the Army people. That when you notice, and people in general are getting that frustrated just with regular medicine too, because you go in, it's a waste of time. They're like, yeah, we checked your basic labs, they look fine, have a good day. It's a waste. People are getting frustrated. So even just within business, and then health, are you settling, and is there more that you want to do?
Okay, so you're talking about self-identifying a limitation of capacity. You're in your entrepreneurial journey where now you start seeing that there are some physical limitations, or probably the most likely marker here is that you're constantly fatigued.
Yep.
Right?
Yes.
So because I see that in other entrepreneurs. You see, like, I'm tired all the time. I don't have time to work out because by the end of the night I'm burnt out. So that's a clear red flag that's raised.
Yes, and I challenge people a lot, even in our practice. I talk about ancestral medicine, meaning Homo sapien. This has been around about 250,000 years. So when you're 80, should you get a special bed, or should you still be crouching down and playing with the children? Like, when we look at cultures where, Aboriginal cultures and all that stuff, like, yeah, they're still carrying heavy stuff, walking with the tribe, and they can crouch with their butt close to the ground like a 2-year-old. That's a really good skill. If you can't do that, something's off. And maybe that's a good challenge, is can you sit in a chair, cross one ankle across the other one, without picking it up? Can you just cross your leg?
That's your screening test. You might be losing a bunch of people, but
you know
we
what?
live different lives now. We're very sedentary. How has the work from home impacted our, our physical well-being through the lens that you have?
So, working from home can be amazing. I work from home some days. I love it. So, there's simple things you can do, like if you're working from a desk all day long, you can stand up. You can even get a $150 treadmill and walk if you're not talking to people.
Because I think that would be like at least North American cultural shift that has happened recently. Like prior to COVID, we were moving more because we at least had to commute. Right? So we're moving more, and we had to walk to the water tower, if you're working in the office. But now we're all working at home. You can stay in a chair for 8 or 9 hours, and then move to a couch.
So a simple thing to do with that is, even if you have a step counter. There are days when I've worked from home, and to me this is horrifying. I like a minimum of 10,000 steps.
What are you at now? I'm at 6.
I'm at a message on my screen. Oh yeah, I'm at 6 too. But there have been days I'm working from home and it's noon and I'm like, I don't have 1,000 steps. Like, oh my gosh. I had patient appointments, doing all these things. So it's an opportunity. It's such a great opportunity if you're not wasting 2 hours commuting. Anyway.
Okay, all right, so big takeaway here is there may be 2 types of personas that we can identify. The entrepreneur that's investing their body into the business.
Yes.
And they're not winning the ROI battle there. So they're depleting more than replenishing.
Yes.
That's an important person to take note, because if you're investing it in, that's great. Like, the business is benefiting from that. But if it's a depleting resource, you're going to run out. Right? So the message to them there is, you can continue investing it. Just make sure you invest in replenishing, so that you can continue. Otherwise you don't get to the burnout dead end, pun intended. Or the entrepreneur that maybe have some more stability but wants to take it to the next level. Same type of messaging. There's opportunities with you or with others that where you can have a quantitative assessment, your report card, to show you and hit that technical mind to give you practical steps on what to follow, whether it's augmented by wearables, to give you the bell and whistle,
Definitely.
or just with, through a healthcare coach that takes you through the process.
Yes, and I'll say this, a lot of people, it's never too late. And I say that to people who've had heart attacks. Like, if you still have a heartbeat, we can keep moving forward. You're just a little off track, but we'll get you back. But with the people that say in 15 years they're going to retire and then we're going to do great stuff, it's like, you're not going to be able to walk at that point.
Right, if you're burnt out there, then what was it for?
Yeah, exactly. So I'm grinding, I think you're grinding, keep going. But also, one of my jobs is to take care of me. And we say this a lot to our people.
So we can keep grinding, like the business is the marathon.
Oh gosh,
no one's winning the sprint race to the end. You'll run out. It's a marathon. So you got to be able to hunker down and keep going. Time is our most valuable weapon.
It is, and why are we doing what we're doing? That's the sense of purpose part. So it's either your friends, your family, your goldfish, whatever it is, you want to be there for them and be able to have fun.
Wonderful. All right. Yeah. Adam, thank you for joining us from Ascent Concierge Medicine.
Yes.
Nailed it. All right, we're here live on location at the MSPExpo in Fort Lauderdale. All of these shows have been brought to you by the Managed Service Provider Association of America. Adam, thanks again for joining us.
Thanks for having me.